This one is for the patients out there who have gone to any sort of healthcare provider with a musculoskeletal complaint. And if someone is using fear to push you into making a decision, that is a big problem. And we see this all the time in musculoskeletal care. And I'm going to set the stage here. I'm not anti-surgery. There's going to be a place for it, but I am anti-fear-based messaging. And this is where patients get led in the wrong direction. And you've heard it before. Your shoulder is all tore up. It's degenerating. It's only going to get worse. You need to fix this now before it gets too bad. I know you're only 30 years old, but this shoulder looks like somebody who's 80. You've all heard these things, or somebody has told you these things were said to them at an appointment. And this language is designed to do one thing. This language is used to make you feel like you are running out of time and to create pressure on you to make a choice. But this is what most people are never told at these appointments, is that every single finding that is being used to create fear in you, to pressure you into making a decision, is seen on every single person out there walking around that has zero pain and zero symptoms in the same area. And there are studies that show that 100% of asymptomatic shoulders have abnormalities on imaging. So seeing something on the MRI does not make that the problem, but it can be used against you to pressure you into making a decision. And your body is going to change over time. And it doesn't mean that it's failing. It means that it's going through its stress, recovery, and adaptation cycle. So the real question isn't, what does your MRI say? The real question becomes, what can you do about it? And over the years, I've worked with lots of people who were told they had full tears, told they had just incredible amounts of arthritis, told they had structural damage that could only be fixed with surgery. And we ended up pressing overhead again, doing pull-ups again, getting their bench press back up. And we didn't fix anything, we improved capacities. If you have severe traumas, if there's something that's structurally unstable truly, if you're having progressive neurological loss of function, now we're talking about medical evaluation, and we might actually be in situations that have time not on their side. But most musculoskeletal discomfort does not fall even close to this category. You're just having some pain. And surgery is never a good option for pain. But unfortunately, these people that come in with just pain are talked to like they're completely broken. And fear-based messaging takes the control of the situation away from you. And it makes you feel like the only option that's left available is to fix something immediately. But you always have other options. We can always work on rebuilding your strength, rebuilding your capacity, improving your tolerance to certain positions, improving your control over what you can do. And then we can actually turn around and see what your body's still capable of doing. So don't let these healthcare providers use fear to force you to try to force you to make a decision. Make your decisions based around what you can turn around and rebuild. And if you want something that helps you work through this without fear-based messaging, rebuild your shoulders with the link in my profile. I wrote up a big plan called Fix Your Shoulders. You can check it out, help you get to work.